And Madam Chair, members of the board, and Madam Superintendent, student and employee wellness is the blueprint for academic success, personal achievement, and the belief that we can achieve big dreams. Individual wellness is an active pursuit of growth in our own personal health and requires intentional actions. As a school system dedicated to student success, we knew it was our responsibility, board, you knew it was a responsibility to create the systems and structures necessary to create the conditions for our students and our employees to thrive. Henry County Schools is leading the way in this effort, and I'm excited to share our progress. The compass for the future continues to drive the work for Henry County Schools. Today, we will discuss how this work, guided by your core beliefs that all learning environments should be supportive, safe, and secure, our community-inspired strategic plan and actions to advance students' and employees' health, wellness, and support structures, and your priority student outcomes, which hold that every student will be ready for life with strong skills, personal health, and well-being. As we get started with this great conversation, I will be remiss if I did not take an opportunity to highlight some of the most essential members of Henry County Schools. I'd like to point out that last week was National School Social Work Week. Social workers work passionately to provide comprehensive services to our students and families to make sure that barriers are removed so that students can access every learning opportunity that is available to them. The theme for 2022, social workers shine brightly for their students, families, and school communities. And our Henry County School social workers definitely fit the bill by being a light in the time of darkness for our students, families, and employees in Henry County Schools. So I would like to definitely take the time to show our appreciation. Our community-inspired strategic plan guided us to create the systems that our students and staff needed and strengthen the existing systems that have surrounded our students with care. The importance of wellness in our lives as a blueprint for success is evident. This is the vision for the structure that our district is creating, not leaving these conditions to chance, but building by design and with intention. Last month, when I shared the report on the involvement of our comprehensive school counseling program, it is important to note that these initiatives and tactics work together to create the conditions for learning and overall success for each student and employee. I will share the progress of creating a wellness structure that addresses the personal health and well-being of students and employees of Henry County Schools. So let's take a look at our priority student outcomes. The work of the strategic plan and initiatives align with priority student outcome 3, students demonstrating wellness and readiness. We know through research that a clear focus and intentional action in these areas focus on developing skills that create healthy identities, be empathetic, manage emotions, achieve personal goals, and build and maintain positive relationships, and make responsible decisions lead to improved student outcomes. So, what are the actions that we are leading for our divine outcomes that we set? Now, you know that I'm elated to highlight the work that you, our board, have been able to have your superintendent and district leaders share the story across the nation, not just here, but across the nation. Henry County's uniqueness rings true because of 2 areas that we've identified and cared deeply for in our district, which are Henry Learns and Henry Cares. Henry Cares is a demonstration of actions that exemplify our commitment to systematic structures for student and employee wellness. As I mentioned, wellness is an integration of multiple components of our lives and the active pursuit of their continued growth and balance. The power of connections and relationships have been demonstrated through years of scientific research. As we've monitored conditions for our youth even before the pandemic, you heard us talk about connectivity. We noted a need for this, a reassessment of how student and employee wellness needs were addressed. Multiple and rapid changes in society have necessitated a review of how students engage with their environment, how they receive and process information, and how our current school structures and processes can be elevated to prioritize the well-being while they learn at high levels. Board, you were having this discussion before the pandemic. Additionally, we believe that our families and community must be engaged as key contributors to the fabric of care, in which we believe all children and employees achieve their absolute best. This was further amplified through our community voice and the development of our community-inspired strategic plan. Over the past few years, Henry County Schools has focused intently on relationships, connectivity, and this is my favorite part, the belief in the capability of all students. We have also navigated our system through 2 years of a pandemic, which you heard earlier today. That has further illuminated our responsibility to create the structure that's needed to intentionally create the conditions that who we are today, is required. Before the design and implementation of our wellness support structures, we did have an understanding of the deep connection that well-being and connection have on overall student and teacher success, which was validated by our community's voice and the understanding that wellness is multifaceted. But there were identified critical areas for immediate attention that were answered, which came at the cost of existing job families and structures making sacrifices within their primary job duties and responsibilities to fill those gaps to meet the identified need. So this was an extra layer of work added to them in addition to their responsibilities. Innovative practices were developed and implemented in pockets throughout the district with responsive efforts geared toward meeting the immediate needs of students and families. Our schools have always moved. They've always shifted and adapted to meet students' needs. However, there was a deeper need for structure, leading to a systematic approach to wellness instead of pockets here and there. You may recall that November of 2021, or you may not, but I shared with you about how, with your leadership, our district laid the foundation that ensures that we do not leave wellness to chance, but instead we lead systems and structures that embed and weave wellness throughout our school and district culture for both our students and our staff. The foundation was set based on assurances for all students that we guaranteed to our families, a foundation through a newly developed mental health and wellness department and continued focus on proactive solutions versus reactive solutions to meet identified and forecasted needs. Since we last met, the progress has been incredible. Each of our schools, with the support of the district, has engaged in standing up a mental health and wellness department to help alleviate the strain of our job families and ensure that we do not sacrifice the critical professional functions to fulfill these wellness gaps that have evolved over the years. The department serves all 53 schools and programs with a laser-like focus on student and employee wellness. This is a mental health and wellness facilitator that's located in each school building. And they're designing systems that measure wellness and implements a systematic and comprehensive wellness framework. So we took the role of the mental health and wellness facilitators team very seriously. And because of that, we were able to attract dedicated employees who had solid backgrounds in the work, meaning a combination of clinical and classroom experiences. We were able to gather top-notch employees to work in these positions. However, to ensure the strong foundation for each employee, we engaged the mental health and wellness facilitator in a robust training model to include trainings ranging from youth mental health first aid to conditions for learning in the classroom setting. This has led us to a systematic framework for leading wellness in Henry County schools. This includes an articulated alignment and integration with instructional and leadership frameworks, a comprehensive positive school culture strategy, immediate access and connection to needed resources, proactive wellness activities for each school building and for staff to have those activities as well as students, and then a system for monitoring, reporting, and evaluating student and employee wellness. Employee wellness remains a priority for you, board, and as a result, it remains an important focus that is included in the development of our wellness model. Through our cross-divisional collaboration, we were able to design programs for our newest teachers to achieve overall well-being during their induction years of teaching. through this program, our new professionals have a safe space for reflection, collaboration, and learning in a non-threatening environment to address their wellness needs. Our mental wellness facilitators have been trained and serve as wellness ambassadors at each school to promote employee participation in our state health benefit plan, Be Well initiative. They support and engage our employees on methods to improve their overall health and assist them with gaining a better understanding around their habits and the right health goals and plans to achieve them, right here at our fingertips. In addition, they're engaged in professional development, and they're provided training to educators in the building to provide further skills and evidence-based resilience strategies. And we also use wellness as a recruitment strategy. People want to know that you care about them when they join your workforce. So we also tell them about our wellness model in our district and our intentional commitment made to taking care of our employees. We also have an employee assistance program, and we partnered to provide comprehensive EAP services for our employees. These services, although confidential, they include assessment, counseling, referrals, and follow-up for any kind of personal problems that may affect an employee's job performance. Services is also available for legal and financial concerns, child care and elderly care, pets, and academic issues and other work-life matters. Now, board, I hope that you are proud of the incredible impact that your vision has led our schools and leaders to be able to accomplish for health and well-being. In this, although we've made great strides, we still have a lot to look forward to in our future. As we look to the future, you and our community can expect to experience a learning environment in which Henry learns and Henry cares, where wellness is cultivated and becomes second nature in our instructional framework. It's nothing in isolation. They go hand in hand. This will be accomplished through the development and integration of wellness standards with learning standards, where conditions for learning are created for all students. The three components that will be a part of this model: positive relationships, a nurturing learning environment, and mindsets and skills. These are important skills for our students and our employees to have. There will be aligned resources and toolkits to help with and support the implementation of these standards, because we have to make sure we have resources available to our staff. A creation of a Henry County wellness model with defined pillars to drive action, and strengthening our care team model to support all aspects of students' needs. We'll have on-site access to health care through our telehealth, expansion of community members in defining wellness needs and promoting well-being as a school community with our health council, developing wellness teams in each school along with the ambassadors, and an expansion of our employee assistance program to further surround our employees with support and access to resources. Now, this is just a glance of the amazing work that lies ahead for our district and our community. Innovation is happening, and I cannot wait to share the progress every opportunity that I have to do so. So I hope that you don't get tired of me, but it's great work that we must continue to share. Now, it's hard to believe that our work in building wellness systems started less than 9 months ago. We talked a little bit about our employees. Since that time, board, as you know, our mental health and wellness department has added incredible value to both the students and staff and the many other job families that have been strengthened with their presence. It creates a structure and leadership for critical areas that are underpinning sustained success for each of our students and our community and staff. The community's voice, your leadership, inspired a robust onboarding plan to prepare our mental health and wellness team to step into this role and make an immediate impact. Over these past 8 months, our mental health and wellness team has engaged in coordinated work to implement check-ins for over 24,000 students, engage in data analysis with school leadership teams, and design action plans that center around well-being. Our team continues to implement a system for care team and individual support for our students and employees, ensuring that every student knows that they have a caring adult in their building. They support this work through multiple checkpoints on our students throughout the day, increasing attendance and re-engaging into school, developing action steps with school teams on improving conditions for learning, and providing behavioral health support and engage in prevention activities and intervention activities. Identifying and creating systems to address universal needs, and as I mentioned earlier, there was a strain. Now they're reducing that strain on our critical job families by aligning focus through our aligned systems of support. Now, we talk about all this, but we always want to know, what is the impact? How is this really helping? Our community-inspired strategic plan guided us to create the systems that our students and staff needed and strengthen the existing systems that have surrounded our students, like I said, with care. Since I have last updated you, our outreach did not stop. Let me share the impact of our current wellness efforts. The data that demonstrates both the use and impact of these services validates the voices that we've heard throughout this process. So let me tell you a few numbers. We have almost 20,000 students who've received targeted support provided by our school-based mental health and wellness facilitator. We've had about 7,800 parent contacts made by our Henry County Schools mental health and wellness facilitators. We've had approximately 6,000 teachers and staff who receive specific support by our Henry County School-based mental health and wellness facilitators. We've had about 26,700 individual counseling sessions by our school counselors. We've had approximately 117,500 student participation in our counselor core curriculum lessons, which they're able to do now because of that strain is not as prevalent as it was before. We have 3,016 graduation coach individual sessions to help middle and high school students stay on course with academics, 1,200 students enrolled in credit recovery at high schools through academic programming such as Georgia Virtual or school-based courses. About 7,330 school psychologist consultation services to teachers and administrators on strategies for student support. About 3,350 school psychologist consultations with our school student support teams through the SST process. About 2,028 school psychologist parent consultations, and approximately 850 students evaluated by our school psychologists for evaluation. About 106,000 student visits to school clinics, and almost 4 million meals have been served through our Henry County Schools Nutrition Department, providing school-based meals as well as curbside meals. 24,176 food resources from Operation Lunchbox for our students identified beyond the school day, and 14,000 approximately social work family contacts, 2,800 approximately social work individual counseling sessions, about 1,059 suicide prevention assessments, and about 600 social work home visits. Now, you heard me talk a little bit about our nursing and clinic aid teams, but they're working hard meeting the medical needs that our students experience while at school. And these medical needs have risen over time. We know that we must first meet the medical needs and have viable plans of action before our students and teachers can engage in learning. Of those 105,000 visits to the clinic, listen to this, 77% of those students were able to return to class with clinic interventions instead of going home. They were able to remain at school and learn. This is impressive, especially while our schools have been weathering the impact of a pandemic. Now, the wellness systems of support have aligned coordinated comprehensive services to meet the wellness needs of our families and students, from technology to dental care. These wraparound supports remove barriers which increase the access and opportunities for students to thrive. We've had food pantries, we've had mobile health units, we've had clothing pantries, we've had our communities. Whenever we needed something, all we had to do was call, and our social workers would make sure that those services were aligned with our mental health and wellness facilitator serving as that point person to make sure that they get the appropriate resources to the right person. So we've had some amazing things to happen for our students and families because of this work. Now, it's obvious that a collection of exceptional work and investments have provided a systematic opportunity to address the personal health and well-being of our students and employees. The arrows in our compass, as you see, for the future point to this commitment through your core beliefs, the strategic actions, and the priority outcomes. Henry County Schools is a system that is working to get it right. However, there's a missing arrow, which is necessary. Take a look. It's necessary in strengthening and sustaining a systematic, integrated, and collaborative approach to well-being and learning. That arrow is pointing to the area that says core policies. A policy will provide the much-needed stabilization for how we value and commit to the full range of wellness supports that are needed to enable each student to achieve. It will be intentional, and we won't leave it to chance. Madam Superintendent, that concludes what I've prepared to you. I turn it back over to you.
Thank you, Dr. Madden. Madam Chair, that concludes what we have prepared, but remain available for any discussion.
Thank you, Dr. Davis, and thank you for that amazing update, Dr. Madden. At this time, does any board member have any questions or comments? I don't see any. Oh, I'm sorry, Ms. Pope. Yes.
Yes, Dr. Madden, thank you so much. I'm so grateful for that investment in our mental health and wellness facilitators. And anytime I'm in a school, I hear from principals and staff, like, how did we ever do it without them? So I'm incredibly grateful for that commitment and just the groundbreaking work that they're doing to support our students and our staff. So thank you for the update. And I couldn't agree more that this needs to be in policy. That is our role in this organization, is to govern through policy. So I'm excited to partner up with my colleagues so that this can be solidified and really grounded, so we can continue to nurture the whole child and the whole individual and be good stewards of these precious resources we have. So thank you so much.
Thank you, Mrs. Pope. Mrs. Edwards?
Thank you, Dr. Mann, for that lengthy report.
Told you I had a lot to say, Mrs. Edwards.
Because it was so lengthy and, you gave a lot of details, could you explain briefly the difference between Henry Learns and Henry Cares to our parents who's focusing in on this meeting today?
Absolutely. We want to make sure that when we say Henry Learns, we're talking about our academics. We're talking about classroom instruction. We're talking about support for our professionals and resources dealing with academics. But then you have that other layer. You have the caring and relationships and the ability to work hand in hand together and making sure that we have a caring adult for every student in our building. Our students have to know that they belong. They have to know that they care. But we also have to make sure that we never take the focus off of learning as well. So when we combine those two, that's powerful.
You talked about how many people have been served, how many lunches have been served. Could you give us an approximate number of staff members that that's employed at the Henry Learning Center, approximately?
When you say the Henry Learning Center, how many are employed there? Well, we have
because you've served a lot of people. And I'm not talking about just staff, but the community. You serve a lot of people in the community. So approximately, do you have 20 people employed there at the center that's really helping and reaching out to the community?
So when we talk about those services aren't really people that are necessary at the center. Our center houses our student services team, our family support services team, our exceptional education, our federal programs. But we do have some organizations that are serving adults for adult education purposes. We have Southern Technical College over there partnering with us. But we also have Connecting Henry that's housed there. But whenever we need to contact our services or the people that are partnering with us in the community, our social workers have those points of contact, and we're able to, in our family services, and we're able to coordinate it through there, but they're not necessarily housed at the center. Sometimes we host events there, Mrs. Elwood, where we're able to hold our holiday events for families to drive through and receive opportunities from our community when they come together to serve our families. And we also have, like we did the vaccination clinic there as well. So a lot of times we host it at that site, but they're not necessarily housed at the site.
Okay, thank you so much. I was asking a question because I ran into a young lady at the service station the other day, and she was talking about some services that she needed, and I gave her my card and asked her to call me because I was trying to guide her to the center. She didn't know where it was. So I guess because she lives in Henry and she had just moved here a couple of months ago and she wasn't aware. So I would just like to see information still being provided to the community for newcomers to Henry County that's not aware of the Henry Learning Center.
Absolutely.
Okay, thank you.
Yes, ma'am.
Thank you, Mrs. Edwards. Mr. McDaniel?
Thank you, Madam Chair. Not to prolong, but to ask just a couple of questions. When we say that we have developed meaningful relationships with peers and adults, and have the opportunity for their voice to be heard in the school building, someone may ask the question: how is that actually being done? How do we ensure that all of our scholars have someone that is a peer, an adult, or that their voice is being heard in the school building? So how are we ensuring, because when we say ensure, that's very heavy, very weighty. So how do we ensure that that's actually happening?
So one way that we ensure, we do use our check-ins with our students, and we also have our mental health and wellness facilitators. If there's someone or a student who is having an issue or a concern, they'll be directed to our mental health and wellness facilitator, or they may be notified. We look at particular data, or there are opportunities for them to talk to a counselor or talk to a social worker. So someone is identified as having a problem, or a child is sometimes not necessarily identified, but because of the training that they've seen or experienced, or are able to look at and identify, this child has experienced trauma, this child has experienced something, this child is withdrawn. There are signs that are evident for our professionals to use to identify them. So then from doing that, they're able to then put in, assess the situation, and then they're able to move forward with making sure they're providing the appropriate services. That is one of the two of the three ways that we do it, but there are other ways that they're able to be identified. Okay,
so, and thank you for the explanation. And so the reason why I asked that question is because we have talked about our mental health and wellness facilitators for some time, and I kind of harp on this almost every month that we talk about the mental health and wellness facilitators, that soon they will transition from being ESSER funded to where we as the county will have to pick up the tab to ensure that they continue to do the job that they're doing. And so I know that there's a commitment amongst my colleagues here, but I don't want us to forget the importance and stress the importance of our mental health and wellness facilitators and what they're doing for our scholars and for those teachers that may need someone to just talk to. Because the reality of the fact is that everyone, I think there's a song that says, everyone needs a shoulder to lean on me. And we all have someone, we all need someone to lean on. And so I think that we have to remember the importance of what they're doing. Lastly, we talked about a positive school culture. Culture is very important. Culture is important for our scholars, but culture is equally important for our teachers. It's equally important for our staff members. And one thing that I hear a lot throughout our schools and even from school members is about the culture and the climate of our school system. I know that we have talked about that. I know it has been well discussed here on the board amongst my colleagues, but that is something that we cannot forget either, is to ensure that we do have a positive culture and climate in our school system. And so therefore, I will once again ask and make sure, if possible, that prior to the beginning of the next school year, that we have a platform in place that addresses cultural sensitivity, and that it is done and given twice a year. And that even we as a board sit down and take that training, because how can we ensure others do it when we ourselves do not take the training ourselves? We have to lead from the front. We have to lead from the top. So I'm asking that we do that, and that it be given twice a year if possible, because we have to understand we're in a diverse time. We meet and talk with many different people. So that is something that we need to have. And other than that, Dr. Madden, I just want to say thank you for all the data that you have provided. I've written down as much as I can. But one thing that I love to see is that we are saving lives. And if we're doing that, then we're doing our job. And so I commend you and your staff for what you're doing. Continue to do the good work. And we as a board have to support what's going on. Thank you.
Thank you, Mr. McDaniel. Any other questions or comments? Mrs. Edwards.
Did you have one? I just want to just mention something about what Mr. McDaniel just said, and it is very important because we are saving lives. We don't realize how many lives we've saved in the last couple of years, since the last couple of years has passed by. But I, too, agree with the culture climate It's extremely important. Mental health facilitators are doing an excellent job. Would like to continue to see them continue their work in this system, even when the ESSER funds run out. Somehow or another, we need to make sure, and I'm looking at Ms. Shanika over here, make sure that we continue, to find funding for the mental health facilitators, because it is very important. Thank you.
Thank you, Mrs. Edwards. Any other questions or comments? Okay, thank you for that, Dr. Madden.
Thank you.